Out as a matter of pending business, Senate Bill 339 by Senator Eltife relating to the medical use of low THC cannabinoid oil. The chair calls Gretchen Von Allmen, Dr. Freedom Perkins, and Jeff Davis as the first three witnesses. Senior Rusty, there are 46 people registering but not testifying. I'll accept a motion to enter those into the public record. So moved, Mr. Chairman. Without opposition, so ordered.
Add some documents to the committee.
Please state your name, begin your testimony.
Go first, me second.
Ms. Allman? Gretchen Von Allmen?
Second, me third. That works. Me first.
Yeah. I'll go first.
You'd like to go first? Very good.
Yeah. My name is Freedom Perkins Jr., MD. I am a pediatric neurologist and epileptologist at Dell Children's Medical Center. Thank you, Mr. Chairman, and members of the committee for allowing me to speak. I am in support of the bill. I would like to speak briefly about intractable epilepsy, what the term means, and why it's important for all of us. Epilepsy is a condition where seizures occur recurrently without provocation, and it is deadly. There are 3 million Americans with epilepsy in this country. 30% of them are intractable, and by definition, that means that they have tried at least 2 medications and failed. 149,000 Texans are technically intractable. We do not have all the resources that we need to take care of all of these people to the utmost despite our best efforts. Many of these patients are on multiple medications, not 2, not 3, not 5, but they've tried 10, 12, 16, sometimes 20 agents and failed. Epilepsy is dangerous and can cause death easily. Approximately 1 in 1,000 people die as a result of sudden unexplained death. When you're on multiple medical agents, that rises to 6 to 9 patients per 100,000, or roughly 1 in 150. I believe that this medication, which is more or less a nutritive agent, has extremely low risk for negative side effects and would represent a possible alternative treatment which would augment therapy. Thank you.
Thank you, Dr. Perkins. Members, any questions of Dr. Perkins? Very good. Gretchen Von Allmen, UT Health Science Center, Houston. Senator.
Hello, thank you.
1 second. I'm sorry.
I'm
Senator Taylor.
So is there someone on the witness list who is an internal medicine specialist, someone with
These first 3 witnesses were Senator Eltife's called witnesses to.
I'm sorry. I'm just trying to make sure I ask the right questions to the right person. So I just figure out who is the internal medicine specialist. So I'm not asking.
I'm not for sure we have an internal medicine specialist registered to provide testimony.
Pediatric neurologist. That's a lot of syllables. So that's very impressive.
But the pediatric neurologist and Ms. Von Allmen, are you a physician or?
Can we both state our credentials again? I'm sorry, maybe I didn't make it clear. I'm a pediatric neurologist and epileptologist. I am board certified in child neurology, actually in neurology with a special qualification in child neurology. I am also boarded in clinical neurophysiology with a specialty in epilepsy.
Wow, that was good.
Sounds good enough to me.
It's the same.
If you don't mind, Mr. Chairman. So just so I'm clear, my understanding is that when it comes to medicine, dosage is very important.
Correct.
Is that a fair statement?
Yes, sir.
And so when you have a plant, how can you be sure that you're getting the right dose?
So it's actually measured out by milligram. We can actually calculate how many milligrams of the CBD oil the patient would be receiving.
But is that, most medication is a chemical compound, right?
Correct.
And so it's manufactured, however it's manufactured, but you're making a precise amount of chemical compound. This is taking a plant and processing it somehow. So how, I guess, how am I to take comfort that you're getting the right dose?
Well, I think it's more of a pharmacology question than a neurology question, but
no, I know it is. I'm just not sure if we've got a pharmacologist up here to answer that.
question.
Okay, well, why don't you answer that in a second? And just so I'm clear, my understanding is there are no studies. This drug has not been through FDA testing. Is that correct?
That's not correct.
Okay. Well, actually, Ms. Sherman.
Well, the chair recognizes Dr. Von Allmen to give her testimony, then we can ask questions of either witness. Please go ahead.
Hi, thanks for having me here today. My name is Gretchen Von Allmen, and I'm a board-certified pediatric neurologist specialized in epilepsy. And I work at the University of Texas Health Science Center at Houston. I'm providing testimony today in support of the bill. So hopefully this will clarify a little bit. The cannabis plant has two different components that are effective in the brain. As you know, THC is the psychoactive component that recreational use is after. And the other component is CBD, which does not have a psychoactive feature. So this particular bill is very restrictive in the fact that we would use one compound which has been extracted, from the cannabis plant that is CBD containing only and has almost zero THC contained in that extract. So this is a chemically derived, very highly regulated compound that we would be using for this bill, and it would be dispensed only by one particular source, and so we would know exactly the milligram amount that we'd be giving in this, according to the regulations of this bill. So that's not necessarily true of other states who have passed similar laws, and so we're hoping to improve upon that in Texas. And that's one of our goals. So in terms of what CBD does, it has actually been studied in mouse models and reduces seizures significantly. And phase 1 trials are in process in children and adults. There have been multiple studies with hundreds of patients that do reveal a significant seizure reduction.
Mr. Chairman, you keep going.
Keep going, okay. Up to 70 to 80% seizure reduction was seen in patients in these studies.
Okay, so this is in phase 1.
Yes.
Okay, now phase 1, as I understand it, is safety, not efficacy. So I'm not really sure I'm tracking. So they did a phase 1 that tracked its safety and efficacy?
Right, they're studying both those aspects. Yes.
And that usually is a relatively quick study, several months. And so that's not done, or it's being done?
Well, there have been a variety of studies that have been completed and are ongoing now with hundreds of patients in different locations in the U.S. And some of those studies have had different compounds being used, and some of them have one particular compound that's used. So there's some variability in exactly what those studies have been using.
Okay, so just so I'm clear, so cannabis oil has different compounds in it, correct? No, there's only one compound in cannabis oil.
It's one chemical compound, but the studies that have been done so far are variable. So there's not, just one clinical trial that's been done. There have been multiple reported studies.
But on different compounds or all in the same compound?
Well, for example, there's a study that was out of Colorado that had basically retrospectively looked at patients taking a variety of substances that have CBD.
Was this an FDA study or FDA approved?
No, that was not.
No. Okay. Well, let's just stay on that.
This is the medical evidence that we have so far.
So all right. Let me back it up. So, is there only one compound that we're talking about here? Or are we talking about multiple compounds? Because it sounds like you're saying there are multiple compounds in some of the studies. So it sounds like there are different compounds that have been tested. Are there multiple compounds, or is there one compound?
There's one compound, but there's variable types of studies that have been performed to date. And so that's true in all of medicine, in fact, and especially in pediatric epilepsy.
So you're saying many different studies of one compound? Or
Correct.
are there are there variations of the compound?
It depends on the study.
So some studies have some different variations of the same compound?
I think, can I add something to this? Because it might make it a little bit more clarifying. No anti-epileptic agent is given in this country purely based on class 1 evidence. Most of them have been used based on class 3 evidence, which is essentially observational data. That's the reality of it. And the majority of the agents that are used in children, in fact, fall under that third category. So when we start looking at efficacy of agents, what we're typically targeting is a minimum of a 50% drop in seizures or higher. What the preliminary data shows, and I can't answer you whether specifically what percentage of THC versus CBD oil was in any one of these particular studies, all of them have been extremely low. None of them have had any psychoactive positive effects such as euphoria or a high. What I can't tell you precisely is, was it X milligrams of this CBD versus that CBD versus another one? The reality is that as this comes out, there will be more and more studies that show how efficacious this is in the long run. In the meantime, we have patients that are dying of these diseases such as Dravet syndrome and Lennox-Gastaut. The preliminary data shows that 70 to 80% of patients have a 50% or more reduction in seizure frequency with no significant negative side effects. 10% of them actually get to seizure freedom.
Okay, but just so I'm clear, the studies that you're referring to are or are not FDA approved? I mean, this is...
There is an FDA process that is going on, which is looking at synthetically refined versions of CBD oil.
So,
but that data has not fully been released yet.
Let me shift off. Let me just go to the synthetically refined. So this legislation contemplates natural plants, right?
Correct.
Okay, and then, but what's being tested is synthetically refined, and I assume that synthetically refined...
I misspoke. The GW is not synthetically refined. It is refined from the cannabis plant. Okay. So it is CBD oil.
All right. Thank you, Mr. Chairman.
Members, any other questions? Senator Rodriguez?
Yes. Are there any drugs approved by FDA for these intractable epilepsy conditions today?
It depends on the patient population that we're talking about. For certain age groups of patients who have Dravet syndrome, especially the very young children who have Dravet syndrome and Lennox-Gastaut syndrome, there are maybe 1 or 2 FDA-approved drugs. And I think for Dravet syndrome, there are no FDA-approved drugs currently.
Are there some waiting for approval, for FDA approval?
Well, the problem with most of these drug trials in children is that they're very difficult to do, these very well-controlled, placebo-controlled trials in children, mainly because they have such severe illnesses. And so, unfortunately, the reality of our practice in pediatric epilepsy is that most of the drugs that we have to use are not FDA approved in young children. And they're approved in adults. We extrapolate, we use, phase 3 data from clinical evidence and anecdotal evidence. And that's unfortunately what we're stuck with. So for us in particular, especially treating children with epilepsy and very severe forms of epilepsy, there are not a lot of options that have undergone rigorous clinical trials. And so a lot of these medications are not effective, have very severe side effects, including aplastic anemia, liver failure, and the list goes on. So the patient population that we're trying to address in this bill is a very restricted population of patients who have multiple seizures daily or weekly, up to hundreds, have failed multiple medications that are available, whether they're FDA approved or not, because unfortunately we often don't have FDA approved drugs that we can use. And these patients have also often failed other treatments that are not medication, such as special diets, high-fat diets, called the ketogenic diet, they've failed surgeries, they've failed medical implanted devices that can help control seizures and epilepsy. And so this patient population that we're trying to address in this bill is not everybody with epilepsy. It's not people who, are well controlled with medications that we already have. These are patients who, are at risk of dying on a daily basis often because of the type of seizures they have and because their seizures just don't respond to the medications that we have. So I think that's part of the excitement in the population of these families and patients who are suffering to have the potential chance to try a new medication that has shown very few severe side effects, especially compared to the drugs that we have available right now. After you've tried 4 or 5 medications and you've failed surgical options, the discussion with the parents is, well, we could try this drug that may cause you to have liver failure. We could try this other drug that may make you so sedated that you're not awake at all during the day, or, unfortunately, we don't have anything else to offer. And so I think in that context, it's a little easier to understand why we are so desperate to try a new medication that so far in the trials that we have and in the clinical evidence that we have has shown to be safe with few severe side effects and has shown good efficacy on a level of the other drugs that we often use for epilepsy.
Doctor, are there interested parties that are willing to dispense the, the CBD treatment?
Yes, and part of the construction of this bill was to really provide a very restricted use of only one specific compound that we know exactly what the milligram amount is. We know at least a dosing range that should be a good starting point based on the evidence that we have already. And the fact that we're requiring that 2 doctors specialized in epilepsy or neurology have to agree in order to give the patient the prescription. It's dispensed from only one place. Anyone who prescribes that or is prescribed that in Texas will get it from one place. It will go into the registry. The doctors will be able to keep details of how much the patients are getting, details about the patient's history, any side effects that happen. So all this will be very carefully recorded so that as the other research proceeds, we can gather evidence that it's going to help decide what the true efficacy of the drug is, what the side effects to look out for are, whether there are interactions with other medications, because these are often very complicated patients that we're talking about in this bill.
Well, I want to tell you, I recall reading, I guess it was in the New York Times, an extensive article in the front page some months ago, I think it was this year, on the positive effects of this particular CBD treatment for epilepsy patients, children, and how in many instances it resulted in, I think one of you mentioned in some cases 10% complete.
Yes, 10% had
recovery,
seizure freedom.
And so that seems remarkable. I mean, if this drug receives FDA approval, is there going to be a need for some kind of legislation to allow for the sale, or will the FDA require, some bypass laws prohibiting cannabis in the state?
Well,
I don't know precisely the answer to that. I think the FDA would probably trump everybody when push came to shove. I think the realistic problem is you're looking at somewhere between 5 and 9 years of this process, and a lot of it, while testing is part of it, a lot of it is simply an administrative process. And in the meantime, we have good data that shows that this can be helpful, it appears to be safe, and patients desperate to try it. And we've got people moving out of this state every week to go to other places in hopes of receiving this as an option. And I think it should be something available to Texans.
And by making it so that we can strictly regulate exactly where the patients are getting this, what the form is that they're getting, the actual compound will be the same for all the patients in Texas who get this drug, and that we keep detailed notes about exactly what's happening with the patients, what side effects they have. I think we're in a good position to lead the way for other states to show them this is the best way to deal with a problem that everyone is dealing with. All patients who have intractable epilepsy are asking me every day in clinic, when are we going to be able to try the CBD oil? Do I need to move my family to Colorado or some other state in order to be able to try this for my child? And, if we can do this in the right way here in Texas so that we're regulating the substance, we know exactly what they're getting, and we know that a doctor is monitoring their progress and making sure they're not having problems with it, then I think we as a state are in a good position to, number one, give the patients who have intractable epilepsy in Texas what they really want, which is another chance to try a medication that has a good chance of working for them, even though it's still in the process of being FDA approved. And then it also gives us a way to be part of the process so that we're making sure that everything is safe, things are being done correctly, and that patients aren't just getting it however and possibly causing harm to their children by getting substances that they don't really know what they contain.
Thank you very much. Thank you, Mr. Chairman.
Just in layman's terms, is it fair to say it this way, and you may not want to, but what have we got to lose? If I'm hearing you right, you've got two drugs effectively out there that are not really an FDA-approved compound, that if they don't work, there's really no other real alternative for this particular segment. So looking at it, and I've evolved on this issue very much, and I think that we've done a very poor job as the community involved in this discussion of separating pot from CBD oil. It's time to have that debate and that discussion and move the agenda forward. I don't know that you get it done today. I don't know that I'm there yet. I've heard some great research. I've also heard some that there's a spike in immediate relief and it goes on, and then in a few months later it's back. But that's still relief at some level. But I guess what I heard you say is there's only a couple of alternatives. They have severe side effects and they don't work very well most of the time. So from my perspective, if I'm sitting in y'all's position, talking to a parent that's got a child in this situation, is it fair to characterize what else have we got to lose? And so I think that's what we've kind of function is a mindset. This is the best we have today. It's being proven out. And I think the debate is really relevant and timely. And you're gaining support. I can tell you that legislation always starts with discussion, and really not this discussion, the discussion like this. And we have these internal debates because we know the political side of all these discussions, especially in this area, that we're going to take a beating at some level. But I think this is probably no different than some of the heavy narcotics that we routinely just dole out. So it's time to have that discussion. I appreciate y'all's perspective on that, but I'm just looking at it, if I'm a parent, I don't have anything to lose and a lot to gain potentially.
Yes, sir.
Thank you.
Senator Taylor.
Thank you, Mr. Chairman. And maybe the author might be the right person to ask this, but why not synthetic? Why natural? What's the? I mean, there's a choice that's being made here in the legislation to go natural. That seems to be in the world of medications a rare choice. Why that choice?
Well, I mean, I think that the CBD oil formulation that we're discussing in this bill is really the best regulated product that we have available right now. And certainly as an epilepsy doctor, we're very careful about making sure medications have exactly the amount of active substance that we think they have in them, because that affects dosing, that affects side effects of the patient, and so forth. So, we feel confident that the compound that we would be dispensing here in Texas, according to this bill, would be a very highly regulated compound that has an exact amount of medication in it of the CBD oil, and that's the best evidence that we have so far. And we can certainly adapt that as the phase 1 trials, bring forth data and as more information and is obtained, possibly partially through our registry.
Is there a substantial cost difference between synthetic and natural? Is that driving part of your decision here?
I suspect that the natural would be significantly cheaper. We don't know what the prices in the synthetic would be, but ultimately they tend to be high.
Okay, and let me just say,
If it follows the natural history of how pharmaceutical agents come to the market, would expect it to be expensive.
I just want to say I have tremendous admiration and respect for what you do. You're in an incredibly difficult field of medicine, really very awed by your presence here today, and appreciate everything you're saying.
Senator Perry.
I want to make sure I'm clear, and this is an education for me. I'm told that the synthetic counterpart to the CBD oil doesn't do what the CBD oil does. Am I in error there? Is there a synthetic look-alike, if you will, cannabis derivative or something out there today? Because I had this discussion with someone with an epileptic kid, and I said, have you tried, there's a name for it, I forget what it was, some pill form. And they said, we've tried it and it doesn't work. So are you familiar? Bottom line, is there a synthetic counterpart to CBD oil today? No. I've been told there's not, that this is its own unique makeup.
Yeah, not that I know of.
Okay.
You may be thinking of Marinol.
That's it. Marinol
But Marinol it's synthetically derived THC.
Okay.
And that's what we're trying to stay away from.
I was asking just why, because that may tell me, hey, there's already a pill form.
And it's not approved for pediatric use
I get the
whatsoever.
distinction between THC, I just didn't know. And I think that we all believe there's a synthetic counterpart to it. There's not. Is that
Correct. And that's partly what we want to protect our patients from, is going to other states, there's, so many different things available now. And our job as doctors is to try to help regulate that process so that we know exactly what the patients are getting, and they're getting what has been studied the most and that we know the most about, so that we can make sure they're safe, and that we're following protocols that we have in place already.
Thank you, Senators. I just have two questions for Dr. Perkins and Dr. Von Allmen. You are both pediatric neurologists. Is there a society of pediatric neurology or the equivalent?
Yeah, there's the Child Neurologist Society and the American Epilepsy Society.
Do those societies have position papers regarding this oil, CBD oil?
The American Epilepsy Society has a position that essentially says that they recommend continued study. But they have not updated their position in over a year. So I think that there will probably be changes coming in the next year.
Not as, so could I get that? I'd like to see that. If you have that available to give us contact information. The second thing is, can the CBD oil be modified by some sort of process to make it psychoactive, addictive, in a way that would be detrimental regarding misuse and abuse of CBD oil?
I think that would be nearly impossible.
Never heard that.
The amount of THC that would be remnant in the compound is so tiny that I think you would need voluminous volumes of it to be able to actually turn it into a psychoactive compound.
So you can't heat it up and change the isomers to delta 9
in a practical sense, no, sir. No.
All right. Very good. Thank you for your testimony. Mr. Davis, you're welcome. Recognized.
All right. Thank you. Good afternoon. My name is Jeff Davis. My wife, Shauna, and two daughters, Kendall and Carly, are here today in favor of Senate Bill 339. We're from Fort Worth, Texas, so we're all Texas natives. I'm also representing the fragile patients that couldn't stay all day for the hearing or leave their homes to be here. To start off, I'd like to thank the chairman for setting the hearing, and thank everybody on the committee for their service to the great state of Texas. Our life was turned upside down when Carly was diagnosed with Dravet syndrome shortly after her first birthday. From that point forward, we knew she would struggle for the rest of her life, and we should cherish every minute with her because she has a 20% chance of not making it to her 18th birthday. I could spend hours telling this committee about Dravet syndrome, how it's rendered Carly mentally and physically disabled, how she seizes for hours at a time, has been hospitalized so many times that we stopped keeping count, how she has stopped breathing and been put on a ventilator for days because of the rescue medication she takes, Valium, Versed, phenobarbital. That's not cough syrup and Tylenol. It's heavy narcotics that are abused widely. How she takes multiple anti-epileptic drugs daily that have terrible side effects, and she still has over 100 seizures a day. How helpless and empty it makes you feel as a parent to know that there is nothing out there to help your child. How CBD oil may give her better seizure control, may help her start to develop new skills, give her the ability to say, "I love you, Daddy," and understand what that means, and potentially save her life. All the families here today have similar stories, and they have the same hope for their children that we do. We don't make policy in Texas on emotion alone. This is a complex issue that is difficult to comprehend unless you deal with it every day. So it does take a little effort to understand, even for the most gifted minds in our legislature. I ask this committee to listen to these experts that testified here today and the ones that testified in favor of House Bill 892 yesterday. They're all from different hospitals, and they have no financial motivation to be here whatsoever. We trust these people with our kids' lives, and if they feel the benefits outweigh the risks to treat intractable epilepsy patients with CBD oil right now, I think it is a disservice to the state of Texas for anybody to turn a blind eye. I think if you look at the correlated anecdotal and clinical trial data, efficacy data, and can try to understand how it's possible for these neurologists and epileptologists to prescribe medications that aren't FDA approved for my daughter because she has Dravet syndrome and there is no FDA approved drug for Dravet syndrome. I think if you look at the science on this bill, I think it's very easy to support.
Thank you, Mr. Davis. We appreciate your testimony.
Appreciate your time, Mr. Chairman.
Any other questions for this panel, members? Thank you all. We appreciate it. We're going to get your contact information regarding that position statement of your societies. Chair calls